Today on the podcast, we are going to be talking to Hedwig Neels from Belgium. Hedwig is a physiotherapist specializing in pelvic health with a particular focus on education and awareness. She's a professor at the University of Antwerp, where she combines academic research with clinical practice at the University Hospital of Antwerp. Hedwig is also the founder of the Pelvic Floor, an information platform and community designed to break taboos and make pelvic health accessible and understandable for all women. She teaches both medical and paramedical professionals through the Women's and Pelvic Health Professional Network and is the author of Het Bekkenbodem book in Dutch, a beautifully illustrated accessible guide to pelvic floor health for women. Her clinical expertise also extends to athletes, including both women and men, with a special focus on cycling-related saddle pain and its impact on performance. Hedwig, welcome to the podcast.
Thank you. Happy to be here. Thank you for inviting me.
Yeah, great to have you. Hey, to jump right in, you've built the Pelvic Floor Platform to raise awareness around pelvic health. What was the spark that drove you to start it?
Really, the own experience that it is still such a taboo. I keep on reminding everybody about it. I keep on speaking about it. We built the platform in 2019 or 2020, and I'm all day long speaking about everything which is vaginas, vulvas, pelvic floors, and all the intimate things. For me, it's the same as speaking about knees and ankles. But on the other hand, I still notice every day that it's such a taboo for so many people to talk about it. And another spark, which was really important, that drove me to build the pelvic floor in the way that it is, was that all the information that I was looking for or had to hand over to patients on the current was always way too medical. And then just by hazard, by talking with a friend who did a lot in social media and design and looking at patient journeys and everything, we came up with the idea like the platform needs to be way more accessible, it needs to be attractive, it needs to be something that people are looking for already before that they want to review a certain diagnosis that they received. You want to raise awareness, you want to work preventively, give information to women that are not really looking for it on purpose. So then it needs to be something attractive, something nice to have a look at. And that's what I try to do with the platform and also with the book that I published. It needs to be something nice to have to look at and nice to review.
Yeah, great initiative. And I have to say the website looks great. So your friend has done a great job in terms of design.
Yeah, it's all about looking to the right design for the right population. Yeah.
I think you definitely achieved that goal.
Thanks.
Hey, and talking about misconceptions physiotherapists and also patients, of course, have about the pelvic floor. What would you say are the most common misconceptions?
That's a really good one. The most misconceptions physiotherapists have about the pelvic floor is that pelvic floor physiotherapy or pelvic health is only about Kegels. Like Kegel was the ancient doctor that the first doctor that ever introduced Kegel exercises being just a contraction of the complete pelvic floor muscle group. Contraction, relaxation, that's a Kegel exercise. And it's super important for every patient, I think, but it's not the only tool we have in pelvic health physiotherapy. Pelvic health physiotherapy is much more about raising awareness, breaking taboo, giving information. Education is so important, just letting people understand what they feel, reassure them that what they feel is often not normal, but that they can do something about it. So it's so important that you see pelvic health as education, as a lifestyle tool, rather than only Kegels. I think that's the biggest misconception. It's not only about doing those pelvic floor exercises, it's about understanding the body. And on the other hand, I also need to say the more I got specialized, because I'm, as you mentioned, I'm also working at the university and I specialized in 3D, 4D ultrasound. So I use transperineal ultrasound to have a look at the pelvic organs and the muscles itself. And I must say that in the beginning, it came a bit as a disappointment. When you're educated as physio, you think you can do everything and you can heal everybody with conservative treatment and with just doing exercises. And in pelvic health, I really need to admit that sometimes it's just about some more sagging feelings like prolapse, pelvic organ prolapse, some more laxity in the fibrous tissues, in the fascia, and you can't resolve everything only with exercises. So sometimes it's so important as a physio that you learn to be honest, to have a good prognosis, and also send patients through if you see that you will not be able to solve all problems with only exercises. And sometimes there's more necessary, going from medication to surgery or pelvic health devices, intravaginal devices to support more. So that's also a really big misconception. You can't solve everything as a physio. It's not possible.
Yeah, I think that's a lesson I learned after like a year of being a physio in practice as well. That you can't make everyone better.
And I think you're the best physio if you just also learn where your limits are and are honest to patients, because one of the biggest challenges we have in pelvic health physiotherapy is also to keep those patients therapy adherent. And if you keep on giving them exercises and they're not motivated to do it because they don't feel that it's helping enough, then you're losing your complete motivational tool. So it's so important that you give them a good prognosis. This is what we can reach. And if that's not enough, there are other options, next level options.
Time for our sponsor. Transform your physiotherapy career with a PhysioTutors premium membership. Enjoy unlimited access to masterclasses, research reviews, and clinical tools, all designed to enhance your clinical skills. Join a global community of over 100,000 professionals. Our platform supports multiple languages, making it accessible to professionals worldwide. Don't miss out on this opportunity to excel in your practice. Visit physiotutors.com/membership and start your free 7-day trial today.
And you also wrote a book that is targeted or meant for the public, so for everyone out there. But how do you translate those insights from the book back to clinical practice for physios?
For physios, I think the book is, because the book is not really like, sometimes I thought I should write a second book like Pelvic Floor for Dummies, because actually I've been writing a lot in the book, but still I think it's, if you say for the general public, it's only for women, by the way. It's a book about pelvic health for women. There's a lot about pregnancies, post-delivery, return to sport after delivery, after pregnancies, and also a few parts about women getting older, women getting into the hormonal change period of perimenopause and menopause and postmenopause and aging. So there's quite a lot of information about the female cycle and its effect on pelvic health. But I must admit that I wrote it for like the body conscious women, those that understand quite well how their body is working. There could be another book like Pelvic Health for Dummies. But if you ask me how to translate it into clinical practice and how to use it for physios, I have my books every day with me. Every session of physio starts with some explanation. What am I going to palpate for? Where are we going to work on? So I think what you mentioned in the introduction, the illustrations that we used in the book, they're really useful to just show women better how their body looks, what we're talking about. So those insights and those simple drawings are the most useful to use in clinical practice, I think.
Yeah, so mainly as an educational tool, it's really handy.
That, and another thing maybe that I also use as educational tool is that's a pelvic floor self-check we've developed, and it's also on the website, so on the Pelvic Floor Platform. There is a pelvic floor self-check, which is on the current only also in Dutch available, I must say. But it's also really meant to raise awareness, because it's a self-check who first asks some of the risk factors women have gone through, risk factors on developing pelvic floor dysfunction. So first some of the risk factors, then some of the gynecological and cycle history they had in the past, so about pregnancies, deliveries and everything. Then we ask some questions about about symptoms, and I really ask about all kind of symptoms, because pelvic floor problems are going from urinary incontinence into anal incontinence, which is really a big taboo, not being able to hold stool or not being able to hold farts and having flatus incontinence, as we call it, but also obstipation, having troubles to get stool out. We call it obstructed defecation, really having the feeling that you try to push it out, but that it's not going, that it's going to the wrong direction, having those prolapse feelings, sagging feelings, having sexual problems, pain during sexual course. And, all those questions which are, for me, so normal to really ask, like, do you sometimes need your hands somewhere to push or someone to hold, somewhere to hold your anus or your pelvic floor muscles to get something out or get something in? All those questions, for me, they're so easy to ask, but for many physios, it's hard to ask. And many women don't mention it on their own. So if you use the pelvic floor self-check, we've got a QR code, and it's something really useful to put in like the waiting room, because many women, while they're waiting, they use the QR code, they already use the screening ones, and they see like, oh, those questions, if people ask me those questions, or if the self-check is asking me those questions, then it's probably because I'm not the only one in the world who's experiencing those symptoms, and it's the first step to get them talking. And it also speaks about impact, how much does it impact you. So a lot of the things are like the illustrations, the self-check, everything is just to lower the barrier to start talking about what they feel. I think that's the biggest
a good idea
focus.
with the waiting room.
It really helps, because then they already see like, oh, okay, like it might also have something to do with my problems, or other women are also using their hands or also feeling that they're broken down there, or so it's first daring to start talk.
Let's move on to pelvic health during pregnancy and pelvic health postpartum. Do you advise pelvic floor training during pregnancy?
Yes, certainly. I think it's important. It's a big myth. I've got presentations enough en masse with the big slide. Like, it's a myth that if you perform like in the past days, in the past years, in the like 10 or 20 years ago, gynecologists would say if a delivery was going difficult, or if a vaginal delivery was going too difficult, then they would say to those women like, oh my God, are you an athlete, or did you do too many exercises because your muscles are way too strong? That's stupid, of course. If you look at all different kind of musculoskeletal problems, it's not because a muscle is strong that it's stiff. It's important, or stiff, or like wrongly neuromuscularly used, actually. So, and that's the problem that we see. It certainly is true that some women have an increased tone in the pelvic floor muscles, that some women don't have enough awareness, enough proprioception to well relax pelvic floor muscles. And in those women, gynecologists would say, or midwives would say, like, whoa, they are too strong, but they use the wrong words. It's not because they're too strong, it's because they use it wrong and they didn't learn how to relax or stretch pelvic floor muscles. So in my opinion, pelvic floor exercises are super important during pregnancy too, just to increase that neuromuscular adaptation and awareness. They need to know how to contract, and they need to know how to relax. But we know from evidence, for example, that if women, and there is an increased number of women that experience pelvic floor problems during pregnancy, of course, because the pelvic floor is meant to keep women continent, but also to support pelvic organs. All those tasks like continence and support are way more difficult during a pregnancy, with the weight coming down, the core stability changing because of the gravity point, which is shifting much forward due to the growing belly. So the pelvic floor has a bigger job, has a more difficult job. So we see that in much more cases it fails a little bit. So 60% of women during pregnancy have incontinence. It's important that they know that with the exercises, they will not immediately have a quick fix and will stop having, for example, urinary incontinence during pregnancy. But the biggest goal of pelvic floor exercises during pregnancy is to keep them active, to keep them reassured that they have something under control, and on the other hand, to really prepare for letting go and relaxing on the heat of the moment. If the vaginal delivery is coming and they feel that the muscles are stretching, just a little fun fact, but your pelvic floor muscles are stretching up to 245% of their normal length. Some of the pelvic floor muscles, the levator, ani. So it's crazy. It's really like a disruption. It's really an overstretching of the muscles. They will have a fear response or a fear contraction, a fight or flight reaction, and an increased tone. They need to let that go, need to be able to let the stretch come. Unless, even though they feel that it might be painful and that it's overstretching. So that's really an exercise you can do during pregnancy.
And moving on, so after delivery, what's your advice to physios working with postpartum women who are eager to return to activity or sport, and especially if it's a return to sport to high impact training?
Yeah. Also, while you were saying moving on, I was thinking exactly also that was one of the reasons of anticipating. If you really would have had a traumatic birth where you feel that muscles are overstretched and that after the stretch, the proprioception is decreased a bit, which is okay. It's normal. They have had neural stretch too. It's easier to return to sport. It's easier to return to exercises if they learned how to do the exercises correctly in pregnancy. So it's also an anticipation for that postpartum return to sport that you already start in pregnancy. Then to answer your question, in postpartum, I think it's really important that women just be aware that we really know, we have the evidence that except for functional training, it's also essential to stick to the numbers. It's really, if you don't use it, you lose it, is something we say in physiotherapy. They need to do like proper force training, endurance training before they go over into functional exercises. And if I mean functional exercises, then I mean like everything which is an answer to intra-abdominal pressure increase. So whenever you do more functional exercises, impact sports and everything, we really know that it's good. It's good that they return to impact sports. But they need to be able to give a good answer with those pelvic floor muscles to the increasing intra-abdominal pressure. So that's the logical timeline that you really need to follow. First, work on force in the pelvic floor, work on endurance in pelvic floor muscles, and then when you feel that you're ready to go over to functional exercises, coordination exercises, and impact sports, try to integrate it, and then it's okay. Just as an extra tip to physios that are not pelvic health specialists, just really ask for symptoms, but big misconception, don't make them too afraid, because that's what I started with, the biggest misconception. Sometimes we really see that women have great pelvic floor force and endurance already quite quickly after delivery, because certainly if you work more with impact sports athletes, with women that were athletic during pregnancy, after pregnancy, sometimes you will also really be amazed by, wow, they're doing actually quite well. The pelvic floor muscles are really not that traumatic and it's going well already. But maybe they will still have some urinary incontinence, urinary leakage, because of that laxity that they have in the suspension system. So when the bladder and the urethra are not supported, not suspended as firmly as they were before, it might also be that during a run, the bladder and the urethra are just moving much more, and it's harder for those really good trained pelvic floor muscles to keep you continent. In those women, please don't say, I hate it if I then hear that pelvic floor physiotherapists would have said like, oh, you cannot go back to running yet, because if you leak, then your pelvic floor is not strong enough yet. No, sometimes we see pelvic floor is okay. She wants to go running. She needs the running because she's an athlete. She's ready to return to sport. Then use an intravaginal device. There are many brands of devices that really help to support that bladder and that urethra, and then she can go and she can do return to sport. But of course, also have a good look at diastasis rectus abdominis if you speak about postpartum women. If we want to have a good core stability, it's also important to work on abdominal stability. there's no, it's not a problem if there's still more laxity in the linea alba, but it's important that you train them functionally and that we see that the abdominal wall and the back muscles are working all together in a good coordinative pattern.
Yeah. So just to make a bridge to the knee again, for example, someone tears his ACL, so you want to have the quads at a certain level. I don't know, 90% leg symmetry index, for example. And so it's basically the same with the pelvic floor, if I understood you correctly. Like you want to be able to control the pelvic floor, have enough endurance.
Yeah.
You can also measure strength, right, with devices.
Yes.
And as soon as you feel like, okay, this person, reaches certain benchmarks, then you would say, hey, now you're cleared to move on to, I don't know, impact sports, whatever that is for that particular person.
Indeed. And we do have, if you're then a pelvic health specialist, of course, you have some extra tools to assess the pelvic floor muscles. You can also measure, so during contraction, what's going on and what force there is. But also, for example, we also really need, as a physio, as a pelvic health physio, you also need to measure what's going on during Valsalva. So I always also ask my patients to bear down and push. I need to explain them it's just for once. It's not an exercise that you need to repeat at home. But I want to provoke your problems right now, and I want to see what intra-abdominal pressure is doing with the pelvic floor too. And then sometimes you see that there's we call it ballooning, if the muscles are opening like a balloon because they're still overstretched, and those kind of measurements also give us an advice about readiness to return to sport. So if there's need for a specialized pelvic health assessment, we do have some simple tools to really see if women are ready yet.
Yeah.
And it's true what you were saying about the rest of the musculoskeletal system. It's really the same. What I wanted to add is, except for the force and the endurance, we also can work with resistance training. Resistance training in pelvic floor, you can do it without tools or with tools. If you do it without tools, we call it the knack. It's just called like that. And it's meant like you use intra-abdominal pressure as extra resistance going. So, for example, contract your pelvic floor muscles and cuff, or contract your pelvic floor muscles and jump up. Those are already little tricks to go next level, or contract and even contract a bit more, even more. Some fast extra contractions on top of the normal endurance. Like in some women, you really need to go higher and higher level. If they want to return to high impact sports, you really need to increase your level a little bit more than only force or endurance, of course. And if you need tools, it's also possible. Then there are like vaginal weights that you can use to also increase muscle force a bit. We have some evidence about it, some scientific evidence that it is increasing the time to recovery, so that it's fastening up your recovery. You're faster going to have better strength if you're using the vaginal weights. It's not making the big difference in the end. If you're patient enough, you will reach the same level without vaginal weights. But vaginal weights work for motivation because women feel it better. And on the other hand, it's increasing it's decreasing the training time a little bit.
Yeah. Okay. Yeah. Very interesting stuff.
Yeah.
On your website, you state that pelvic floor issues are among the top 3 reasons female athletes stop sports. Why do you think is this such a blind spot in sports medicine?
Yeah, that's a very good question, and I can't answer it. But I see that it's changing and it's shifting. And I've also been working a lot in Australia, and I have a big international network, and I'm very happy to see that what's happening in Australia and the USA is often then afterwards coming to Europe. I think there's already a bit more interest in pelvic health in Australia, Canada, USA than in Europe, but it's also growing here. So we did see, for example, like this year's sports medicine conferences, they all are having like one small part going about female athlete or about pelvic health. So I think that it's growing, that the interest is growing, but it's crazy. Even yesterday I came from some cyclist teams, and the sports doctors there, they really said like the chapters about pelvic floor and urology and gynecology, those are the chapters that are just skipped so often. Maybe it's also because they are taught by non-experts and they feel too much taboo to talk about. I don't know why it is, but it's amazing how much work there's still to do. It's true.
Do you feel like if rehab is done properly, that we'll be able to prevent that pelvic health or pelvic problems are the reason that those women do not return to sport?
No, I don't think so. I'm afraid that's not true. The idea, what I also describe in the book and what we use in presentations is just that we come from the same sort as the monkeys. Of course, we were how do you say it in English? Viervoeters. So we were walking on hands and foot in horizontal.
Quadrupeds, I think.
What do you say?
Quadrupeds.
Quadrupeds, that's it. So when you're a quadruped, your pelvic floor doesn't have that supportive function so much, and it's not so hard to keep everything closed. You understand? So if the pelvic floor of a quadruped doesn't need to be so strict, so strong, so hypertoned, it's by coming up that our pelvic floor has become smaller, more toned, and stiffer. We need that for all the activities that we want to do. We're getting older, we're sportive, so we need that stiff and good reacting pelvic floor on one hand. But on the other hand, when you have a delivery, and now also we see that women are getting babies on an older age, women are getting larger babies than in the past. So the baby's head is just a little bit too big for the pelvic floor, and we do see that the overstretch is reality. So even if you do good rehabilitation, I'm afraid that we will not stop to have pelvic floor problems in women, especially in those with who had pregnancies and deliveries.
Okay, clear. Hey, let's move on to males, because on your website you also talk about saddle pain in male cyclists. And how does it present, and what should sports physios be looking out for?
Yeah, thank you for the question. Very good question. I need to already acknowledge that I'm not working a lot with males in general, because there are also a lot of pelvic floor problems, just like urinary incontinence, constipation, pain problems in males that are really interesting. And it's also, there's a lack of therapists that are well specialized in it and work a lot with it. So it's a big thing also. We also need to address that. But I must say that I came from gynecology, so I've been working much more on the female pelvic health than on males. But then I fell into the cycling world, started working a lot with pelvic pain problems, saddle pain problems. I also saw that the male riders had the same problems, and that's why now I am treating men riders too, so male cyclists. If I briefly want to explain what you need to be looking out for, it's always trying to understand what is causing the saddle problem, because you need to think as physio in 3 layers. There are 3 layers which make contact with your saddle. There are 3 layers under pressure. If they're cycling, one is the skin and the genitals, like the perineal zone. It's the same for the women riders or for the men riders. You've got the skin and the perineal zone. Second layer are the bony structures, the sit bones and the pubic bone. And my third structure is that pelvic floor hanging up in the bony structures, that pelvic floor mainly containing muscles, but also encompassing or having nerves, arteries, veins and lymph nodes going through those pelvic floor muscles. So first of all, have a look. Is it just dermatology? Is it skin irritation because of bacteria, sweat, pressure, friction? Then start treating and giving advice about skin therapy and skin care, lifestyle adjustments, hygienic care. That I talk a lot about creams and everything, because it's starting with small pimples, irritations, skin things, but then it leaves sometimes when it gets into bigger cysts or nodules, it can really grow into more scar tissue. More scar tissue in that zone can be painful. And of course, what will you see? The reaction of those pelvic floor muscles will be that the pelvic floor muscles will be hypertoned, increased tone, and they return into a chronic cycle of more pelvic pain problems, some coccygeal pain sometimes. So it's really looking into what was the first etiology. Can we change the posture on the saddle? Is there a good stability on the saddle? Is it a skin problem which is causing the pain, or vice versa? Sometimes you can also have a look at why is he developing always like a saddle sore on the left side? Probably because he might have some instability in the pelvic zone if it's more restricted on the left side or on the right side. If we see that some of the pelvic floor muscles are really hypertoned, it might be also the reason of the sore. So you need to look which is the chicken or the egg, but that's the way I try to work with cyclists. And like if we speak about muscles, it's often having a look at pelvic floor muscles, also teaching them how to better contract, but especially then how to better relax, because we haven't been talking a lot during this podcast about relaxing the pelvic floor, but it's also what I wanted to say. It's a misconception. It's not only about contraction. Having the ability, the awareness how to relax your pelvic floor muscles is super important, especially in athletes. And just to name some muscles that we really treat a lot, is very often we see an hypertonicity or trigger points or an increased tone in the obturator internus. It's one of the stabilizers really closely inside of the pelvis, connected to pelvic floor muscles and also connected to the iliopsoas muscle. So in cyclists, obturator internus is really important one. Also very often we see, of course, that the coccygeus and the piriformis muscles can also be some of the reasons that they develop more tension, more pain, lesser stability on the saddle and everything.
Yeah. The more specialists I talk to about the pelvic floor, the more often I hear that relaxation might be actually a bigger problem than a weak pelvic floor.
Even if we speak about the symptoms which you would expect to be the reason of weakened pelvic floor, even like urinary incontinence or things like that, can come from too much tonicity, an increased tone in the pelvic floor muscles or in the surrounding muscles, of course.
Yeah, maybe that's the time to mention my own story with the pelvic floor physio. It's exactly the reason why I went, I had some pelvic pain like 10 years ago or so, and I went to a pelvic floor physio in the Netherlands, and the guy told me I had the strongest pelvic floor he's ever seen.
Okay.
So that's why I tell the story, to show off a little bit.
Yeah.
So I was really
impressed.
proud. So he was like, "Wow, I'm impressed." And it was quite an experienced physio, but I had a problem to relax. So you could see that on the EMG as well. So I just couldn't let go, and that's why I had all those problems. And at the end of the day, that helped me. To realize what my problem was, and with different relaxation techniques, I was able to improve and actually resolve my issues.
Yeah, it's really, really important, and you need to focus on pelvic floor muscle relaxation itself. You can use visual feedback, as you have been using them probably. So you can use visual feedback. You can use ultrasound imaging to let people see how muscles are contracting and relaxing. So start with relaxation of the pelvic floor itself. And then, because of what I told you, the pelvic floor muscles are immediately connected or adhesed to obturator internus, to piriformis. So also that close connection. Don't ever stick to only relaxation of the pelvic floor muscles, but then broaden the region and make sure that you get into good balance, enough stretching, enough relaxation, and rotational exercises and everything of the hips and the pelvic girdle. It's really important.
Yeah, that's how I started. I thought it was the piriformis maybe, so I was doing a lot of stretching, but like for me, it didn't resolve the problem, and that's when I went to pelvic health physio.
Yeah. Super.
Hey, so say someone comes to my practice, and I'm not a specialist in pelvic health, of course. But I do have the feeling someone might have a pelvic problem. So what are some simple assessment tools or screening questions that I could ask this person to get the conversation going?
That's a difficult question. No, it's not a difficult question. First thing, you need to talk about symptoms. I would say it's easier to start to talk about symptoms if you also name some numbers. So if you say we know that a lot of athletes or a lot of women or a lot of men have problems with, for example, urinary incontinence or sometimes even having problems to hold farts and flatus incontinence, might that be something that you sometimes experience, yes or no? So first start talking about incontinence, prolapse feelings, sagging feelings, but also the opposite. Do you sometimes have problems to let go? And you might notice that by having difficulties to go to the toilet for stool, for example, or you might have the feeling that you're continuously having an increased tone in those muscles because there's some pain over there. Do you sometimes experience pain during sexual intercourse, for example? So asking the questions is your first screening tool, I think. And then the easiest thing, even if you're not an experienced physio, is already have a check. If they are able to just easily do that simple Kegel exercise, contract pelvic floor muscles, and relax pelvic floor muscles. You can feel that from outside, from the perineum. You can have a look, but then they already need to be undressed, of course. So if you say like, oh, I'm not going into the intimate zone, I'm still general physio, then just ask them if they are okay, that you put your finger on the perineum. So for women, the zone between the vaginal opening and the anal opening, or for men, the zone between the scrotum and the anal opening. Put your fingers over there and feel if they contract and relax, if they're already aware of doing that, if they just have that proprioception already. If that's too intimate for you, then you can also put your hand on the coccyx, because if you just know the pelvic floor is going from the pubic bone into the sit bones into the coccyx. So if you really do a maximal force contraction and relaxation, you will also feel that the coccyx is pulling in and relaxing again, and pulling in and relaxing again. So even if you stay outside of the intimate zone, you can already just check what their proprioception is. So I would ask them about symptoms and just check the simple awareness of, do they know how to use the muscles?
Time for our sponsor. Are you a physiotherapist or healthcare professional aiming to elevate your clinical practice? At PhysioTutors, we offer a comprehensive suite of online courses designed to enhance your skills and knowledge. Delve into specialized topics such as running rehab from pain to performance, where you'll learn to improve your patient's running efficiency and reduce injury risks. Or explore central sensitization in patients with persistent pain, providing evidence-based strategies for effective pain management. Each course is meticulously crafted by leading experts, ensuring you receive up-to-date, practical knowledge applicable to your daily practice. With flexible, self-paced learning, you can access our courses anytime, anywhere, fitting seamlessly into your busy schedule. Join thousands of professionals worldwide who have advanced their careers with PhysioTutors. Visit physiotutors.com/courses today and take the next step in your professional development.
Hey, I have two follow-up questions, or two questions on my list that we kind of touched on, but maybe you want to add something to them. So the first one is, we talked about Kegels, who everyone is familiar with. And we also said, okay, there's more to exercising the pelvic floor, such as devices that you can use for resistance, or increasing your intra-abdominal pressure, or jumping while contracting. Is there something else next to those exercises that you would add to your arsenal?
Yeah, the supportive devices that I mentioned. But then I speak specifically about women, of course. But it's really, I really stick to the same idea that it is a misconception that women, or it's one of the barriers. We see that 1 out of 3 women is decreasing sportive activities or choosing for another sportive activity because she probably thinks her pelvic floor is too weak to do sports. And often it's not really the muscular system, but it's the fascial system, the suspension system of those organs. So really speak about those internal devices that they can use. If they can just use like a small tampon specifically developed to use it, and they can then go into their impact sports, into their running or into their weightlifting or whatever that they like, and which we know is good for their bone health, for their force in other muscles in the musculoskeletal system, then please keep them on sports. Also, if they need tips about support, or even like sometimes women are already helped with the idea of using menstrual underwear, like underwear which is a bit better already made for some leakage, and so all those simple tips that are not only going to because if you always only address muscles, they really feel the guilt feeling of it's completely in my control, and if I don't reach a situation without symptoms, then I have failed. And that's the barrier, or like the big myth that you need to break down, and that you need to say, no, even if you've done everything that you could, it might be that you still need some extra help, and there is extra help available enough just to make sure that you keep on being physically active.
Okay, and those devices, for example, that tampon, that's like a specific device, not a normal tampon. And also as a follow-up, would you use that forever, or is that just temporary?
In some women, it works forever if they're just using it during their physical activities. There are some brands which have, how do you say it, that you throw it away after you've used it for one day. You have reusable ones too. So different brands, different forms. We even have really medical pessaries, which is a harder form and stronger. It's stronger, but you need to make sure that before you start with a pessary, that the gynecologist has also checked if the vagina is the vaginal walls are strong enough to make sure that you don't have internal atrophy or wounds coming up. So some need some extra advice, but there are different kind of forms, going from the ones that you can just order on the internet by yourself, as if you would go to the shop and or to the supermarket and buy a pad to avoid incontinence. So some are really easy and throwable. The other ones are reusable. For some women say, like, I'm okay with using these for years, while others will already be back in your practice and say after a year, actually, I was super happy with using it, but I hate it that I always need to use it. Isn't there like a more sustainable option? And then there is, you can have an option to speak with pelvic surgeons about supportive devices, about slings for incontinence, about if there really would be more prolapse, about reconstructive surgery. I really think it might not be a taboo to also say that there are extra options, but in some cases it's not necessary yet. And in some women, it will be temporarily. You will see that it's only in like a few months after delivery, for example, and afterwards we know that also the fibers and the suspension tissues and the fascial tissues need to recover for up to 1 year after delivery, so also depending a little bit on how long they gave breastfeeding. So in some it's temporary, and afterwards it's not necessary anymore.
Okay. And we also touched on the overactive pelvic floor, and you mentioned relaxation exercises such as, visualizing or visualization exercises. Is there something else that you can do? You mentioned stretching the hip muscles as well.
Yeah, so don't only focus on the pelvic floor. It doesn't work. One, they need to know it needs some time. You need to focus on pelvic floor first, but then you need to broaden it into the pelvic girdle. Think about all the hip rotators, the hip stabilizers, having the good cooperation and working enough with diaphragmatic release and breathing, because it's one system, the core stability. So having enough attention for that. And then if you really sometimes need to go further in, you can see that also with intravaginal release, you can work with, for example, in women, if you want to use stretchers, there are stretchers or dilators, we call it, to open up the vaginal walls a little bit. If the internal vagina would be the problem, sometimes we use vaginal dilators for women with vaginismus, so pain during sexual intercourse. In other women, like it's not really need of stretching the vaginal walls too much, and you need to go more into those pelvic floor muscles and to release trigger points. Then there are tools like the pelvic wand, for example. It's like how will I explain it? It's like a wand, it's like a handle, which women can use for themselves as if like simulating that the pelvic health physio is going in with the finger and trying to release trigger points manually. Women can use that for themselves. So if you really have like an athletic person or somebody who is self-aware enough, there are some extra tools which can be used. And then I'm also working now and exploring more and more with Tekar therapy, which you probably also know. Like Tekar is diathermy, so it's warmth with radio frequency, which is sometimes claiming to be able to resolve everything, which isn't true at all. But I must say that if to go intravaginally or in the region, even if you stay externally in the region of the pelvis, it is an added value to decrease tension with a comfort feeling, because it has that comfortable warmth feeling for women, and it helps sometimes a bit easier to go into relaxation of muscles. So I'm still trying to broaden the toolbox and experiencing quite good experiences with Tekar therapy.
Okay. Yeah. And that's also a device that you use intra...
you can use, there are intravaginal devices and external devices. Another thing I need to say, you can, as pelvic health physio, if you're experienced and trained enough, you can do intravaginal work. You can also do intraanal work, but I will probably make enemies by saying this, but I don't believe in intraanal work. I think that the body has such an protective fight or flight reaction around the anus. It's completely different around the vagina. So if you want to go intraanally, you always see that people are so uncomfortable. The tone increases so much that it's really hard to reach your goals if you need to work intraanally. So I don't have good experiences. Maybe it's because I'm too direct or something. I don't know why, but I really don't believe in good results with intraanal work.
Okay. Yeah. Hey, the last question category that I have reserved is more about academic research, because you both work academically and also clinically. Where do you see the biggest innovation potential in pelvic floor rehab?
I do think the biggest innovation in pelvic floor rehab will be working more and more on the neurogenic system, and making sure that with devices and with enough attention, we can work more on the, I'm looking for my words, the unconscious stuff in pelvic floor. Because that's really the big difference. If you look to pelvic floor and the musculoskeletal system, it's really not only, pelvic floor is not only striated muscles, okay? There's only 30% of the pelvic floor is striated muscles, so the muscles that we have under our own control. The rest are smooth muscles reacting on reflexes. And the rest is also coming from good hydration, like, for example, continence is coming from striated muscles, smooth muscles, but also good hydration of all of those vaginal tissues, facial tissues, suspension tissues, and everything. So because of that limitation that we have, I think that the extra and the innovative things that are coming will be rather from neuromodulation, neurogenic recuperation, having a better look at how the neurogenic system, the central system, all the reflexes can be increased, improved, than only the conscious pelvic floor muscle work.
So you would already be able to cover the 70% of the smooth muscles by influencing that.
Yeah. I do think that will be the innovation, and I must say that's also why I'm still working in research. I'm using my ultrasound a lot, but that's not research. I use that in clinical practice too. For me, it's great to have really a view on the musculoskeletal system, on the suspension system, on the muscles. So with 3D and 4D ultrasound, it's really beautiful how much you can see, how much you can learn and everything. But then all the part that we cannot really affect well enough will be that other system. And I must say that I'm not, I gave up a little bit on applying for all the research grants and everything. I find myself much more energized by doing my clinical work, by using my ultrasound. So I'm decreasing my research part because I love the clinical part too much, but I still believe and I think there's a big need of extra research, and especially on that domain.
Yeah. Hey, we're slowly coming towards the end of the podcast. So I have, I think, 1 or 2 more questions left. And one question is, what's one thing you wish every physiotherapist knew or did when it comes to pelvic health?
Really starting to talk about it and starting to say what I already repeated a few times, that it's a misconception that if we educate, because that's the big pitfall of education, of course. If you educate them too much, you give them the guilt feeling that they don't know enough or that they haven't done it well enough. Please don't fall in that pitfall as physio. So educate them, but also give them that normal advice that if they feel that with all the exercises and being strengthening or being relaxing and down training in each of both directions, if you feel that you've reached your limits, don't stick to the limits and know that we only have 30% in our hands. You can go as functional, you can stay there as a coach, as a guidance, but don't stick to your own focus. Make sure that you refer them to other ones. If you feel that you've reached your limits, I think we've already discussed that, and that's really what I hope that every pelvic health physio will learn. Don't stick to your own focus, go a bit broader, and also to the other physios, never say that it's only about muscle exercises. It's about a bigger, complexer system.
Okay. Hey, and we've discussed quite a lot of different topics. Is there anything that we haven't touched on that you would like to add or discuss?
Good question. And I'm thinking about... Maybe I've gone a bit too much in all kind of directions. No, I think we've discussed a lot. Also, even my passion for ultrasound, something extra that I try to improve more. It's just because it gives a lot of visual information. Maybe some extra thing is I use the diagnostic ultrasound also. Never to, to over-medicalize. Sometimes we really see that due to pregnancies or deliveries, there is some irreversible weakness or damage. Yeah. If you see that on ultrasound, if you diagnose that on ultrasound, you don't need to say it as hard as it is, but you still need to give the honest information. I often explain to women, for example, if I see that there is some muscle damage or some weakness, that their pelvic floor is like a hammock or a trampoline, and that, for example, like it looks like one of the suspension cords is a little bit weaker, which doesn't mean that your pelvic floor is completely weak, but sometimes it's important that they just know that they've reached already the best they could, and you reassure them. The sentence really that I hear the most, or the testimony that I hear the most in practice, is really like, I'm so glad that it wasn't in my head. I'm so glad that it's, that you understand what I'm feeling, and then we can work towards improvement. And very often they then also learn a little bit how to live with some of the problems, and they just feel reassured. That's the biggest thing I think you can do. So I'm still a big promoter of ultrasound for all real pelvic health specialists. You're going to be better in educating your patients and better in reassuring them about what they feel.
Yeah, definitely helped me back in the day. So
yeah, it really is.
Okay, perfect. And if people are interested to learn more about you or to ask any questions, where can they find you?
Good question. So the Pelvic Floor is the information platform for the bigger public, but also for physios, of course. But that was developed in the years 2020, really for women. So it's really addressing female pelvic health. Also, my book is also female pelvic health. And while on the current now, I do still work at the university and in the University Hospital in Antwerp. I've also launched my own private practice, working more with those athletes, working a lot with cyclists, professional cyclists, and recreational cyclists, women and men. And then I found the men cyclists are really not attracted if they go to the Pelvic Floor website, because it's completely designed to attract women. So I've got my own website now too. So if people want to reach me, they also can use my www.hedwigneels.com, and that's my professional private practice website. So they can find me there. I also have a lot of information on Instagram, both with the handles Hedwig Neels at Hedwig Neels or at the Pelvic Floor, and also on YouTube. I share quite a lot of information if you just look for my name, Hedwig Neels.
All right, Hedwig, thank you so much for your time and for your knowledge. It was a pleasure to have you on a podcast.
It was my pleasure too. Thank you. It's really important, I think, that we raise more awareness and speak more about pelvic health, and that it's not a it is a specialized field, but I'm really sure that it's an important topic for all physios, and it shouldn't stick only in the toolbox of the pelvic health physios. We all need to work towards better pelvic health.
Agree. And to everyone out there listening to this podcast, thanks a lot for tuning in. And also, if you are interested to listen to the podcast in your own language, including German, French, Spanish, Italian, Portuguese, and Dutch, download our new and free PhysioTutors app. Now, it's not that new. It's been out there for 1.5 years, but still. And additionally, you can access the transcript and infographic for this and more other episodes and find more physio content that is useful to you. And as always, if you enjoyed this episode, hit the subscribe button or follow our podcast on Spotify or Apple Podcasts as well. And consider leaving a review if you really enjoyed it. And with that being said, this was Kai for PhysioTutors, and I'll talk to you in the next episode. Bye.